Hi everyone, this is a lecture exploring the use of existential approaches to groups, and I'm really focusing this lecture on main concepts and applications. For any of these theoretical approaches that we're going to explore in this class, my suggestion is that once you sort of find a leaning towards one or two of them, that you really seek some further continuing education, because as you can see in your readings, a lot of these theories are pretty involved. So it's good to work with somebody who's going to be working through the lens that you're going to be wanting to work through as well. But there are some sort of universal concepts related to the existential approach that are good for all group counselors to know. So first, just one thing to keep in mind when we're thinking about existential approaches in group, it's really more of a style and a way of thinking than it is necessarily an intervention, the way that CBT kind of seeks to, change distorted thoughts and change behaviors. Here, we're looking to create an environment that will allow for a deeper sense of self-awareness. And so in that way, it's a much more process-focused approach. And through this lens, it's very optimistic in the sense that it believes that at any point, someone can really embrace who they are authentically and freedom through this lens is really connected with responsibility, personal responsibility. And so the more you can accept your freedom or what you can influence in your life, the more interconnected you'll be with your sense of being authentic and making a change in your future. And there are four major themes in the existential approach that, again, regardless of your theoretical approach, are important topics for group therapists to consider. So, when we're talking about the idea of freedom here, there's the common misbelief that most people want freedom, that's something that we all vie for. But really, when you look at what people come to therapy for, they become very fearful of even having a choice. And so part of, the work that you're going to be doing with the client is to help them take responsibility for their own life and the ways in which they might be conforming or living inauthentically that are creating the sense of stuckness that's brought them to you. And we also have to really come to terms with the fact that we're all individuals. And, when we think of behaviors like, because I have the substance abuse background, I think about codependency. And I'm not a big fan of the word, but I try to contextualize it for clients. So that's when somebody is either too responsible or overly responsible for another person. And I connect this to the idea of existential isolation because we all need to sort of accept and develop a sense of wholeness in who we are and, not become too enmeshed with another person where we don't know where they start and the other person begins. And so that can be an important issue to address in therapy, boundaries, right? Where we've been talking about that on an ongoing basis. The other major concern is this idea of meaninglessness and what does the person want the meaning of their life to be? This is really one of the reasons I like working with college students so much because I get to ask them questions like, what values from your childhood, from your family of origin are you going to keep and which ones are you going to leave behind? And how might that influence who you want to be in relationship to somebody else and relationship to your work. So, and how many, I mean, at this point it's cliche, within movies or sort of that kind of context to think about, a teenager or college student, exploring what is the meaning of life. Um, it's often what, the quote unquote midlife crisis is about. And so it also means taking a pause to explore the importance of spirituality or a meaning system to the person's life. And it's important as a group facilitator to think about, what role do you want spirituality to play or not play? For example, I make a very clear distinction in my groups that while all spirituality and larger cultural identities are welcome in the space, we're going to be focused on topics related to therapy, and I really want them to, if therapy is about sort of recognizing that spirituality is important to them, they should have more than one social support network anyway, right? Therapy is a place to learn how to get these supports in one's life. So this is where we can also start to branch out and recognize the multiple systems that make clients' outcome in therapy successful. And of course, what is the meaning of one's life and death? It's an important part of life to consider what one's legacy is. We know that it's a developmental task, and we all have to grapple with the fact that there's no way to overcome this experience called death. And this can be important for people to explore within substance abuse groups, within grief groups, older adult groups. What was the meaning of their life and helping them to put that into perspective. So that in a group setting might look like exploring, maybe I might ask people about how their families deal with grief, or do they have, certain death rituals? Just what might they want to leave behind as part of their legacy? So that might involve some storytelling. And ultimately, this approach believes that, while we might not be able to control completely our external reality, we can have control over how we relate to our internal reality. And this approach draws from phenomenological theory. And the way that I would best describe this is, imagine that you met Wally the alien, and you had to describe to Wally what a sneeze was. They don't have it on his planet. Aliens don't sneeze there. And you have to describe the lived experience. What's it actually like to sneeze? And that's what the phenomenological lens looks to understand. What is the true lived experience of something? And so an existential therapist would focus very much on the here and now and what's coming up for them in their bodies and their thoughts as they're in relationship to the therapist and the group experience. And we're going to look at the different ways that we develop defense mechanisms that make it difficult for us to take responsibility, and where are we, kind of having excessive demands on our life. And ultimately, we are looking for exploring complexities and paradoxes. But I think, what I might sort of sum this all up into is places of cognitive dissonance, right? Like, where do we have conflicting perspectives, and what do we need to explore about that? Because through this lens, to be human is to be creating. You need to constantly be creating yourself as a human being. And so, what can we learn about ourselves and our own sense of self-awareness by looking at our own paradoxes within? And so we're really focusing on honesty. Maybe you might explore what makes it difficult to be honest, and what does honesty mean in different systems. And you are, helping the individual to widen their awareness of themselves. Uh, I often like to ask clients, when they're telling stories about relationships, are you aware of how you were received in that moment? What were the nonverbals of the person? How was their, what kind of words did they use? What tone of voice? Because I think that this helps them to gain self-awareness and increase their ability to maintain their authenticity. Um, and ultimately, we're negotiating all these different parts of ourselves, our past and our future, uh, and that is part of, what I might call the grist for the mill. And so, you know, the same question that I ask my college students about what values they might want to take from their family and what might they want to leave behind. I could also say, what part of their past experiences do they want to take with them, maybe has helped them to grow and become more authentic within themselves, and what parts do they need to leave behind in order to facilitate greater growth. So if we were to use, again, substance abuse, and then we can look at trauma, um, you know, while they were using in their past, there might have been a lot of negativities, and there might have also, some of what might come out of this is that, their substance abuse was just a form of suffering that allowed them to learn and create a moment of crisis so that they could uh, deepen their own knowledge about themselves and live more authentically and develop survival skills and be flexible and learn about different types of people and experiences and really what it means to suffer. And when we can learn more about all those different kind of things, we have a much easier time connecting with other people. And when we can do that, we don't suffer in the same way. And so developing self-awareness means recognizing that, we don't live forever. That seems like an obvious, but if you look and work with teenagers, you know that they definitely just, it's developmentally normal for them not to be aware. And so developing some self-awareness capacity around that for that particular population is important. We have the choice to act or not to act, and recognizing that we have that choice and are constantly making choices, even if we're not aware, actually. Meaning is not on automatic. We need to seek it. And that can be really hard for some clients, right? I mean, while spirituality can be an amazing source of strength and just a source of life for folks, it can also be a source of great pain and abuse for many. So it's important to sort of help the client recognize systems of belief that they were raised in and, how that may or may not be working for them anymore, and what might need to change to help them feel less stuck or develop into a more authentic person that isn't suffering the same way they currently are. Another point about this approach is that, it's a very, it's a non-medical model approach. So um, these symptoms that people are presenting with, ultimately, while they might have some biological root, the diagnosis isn't really important because it's just symptoms of, an inner conflict. While that is the traditional view, I will just highlight that, you know, most existential therapists today, absolutely, you have to use evidence-based research. So, you might not use a pathological lens so much, but you don't not recognize instances of biological disorders. Like, for example, I'm thinking of like bipolar disorder in particular. There's a clear underlying biological force here. But that saying that might also mean that this type of approach might not be appropriate for that person, or it might mean that they need one group that's process oriented to talk about the meaning of life and, taking responsibility in who they are, and one group to learn skills, which is actually how a lot of outpatient settings are set up. And so, again, here we are facing our anxiety. We're not trying to get rid of it. It's radical acceptance. And if you're hearing some words that relate here to a mindfulness approach, you'll actually find that many mindfulness practitioners operate under a humanistic existential gestalt umbrella. All of those approaches historically are put under the humanistic umbrella as one of the forces of counseling. Um, so we also have to take a look at death and the meaning of death within the person's life to explore the purpose. Um, and we talked a little bit about that already, but just, a common group intervention might mean to write a fake will, or um, who do they think will be at their funeral? And while some of this, that feels like, oh God, like, why would you want to do that? Well, that's sort of the point of this approach, is that life is so precious. We as the facilitators have to really push people to be aware that life is not limitless. And so, what do we definitely, for sure, want to get out of this experience we call life? And when we're thinking about neurosis, or the presentation of pathology, that's the existential neurosis of meaninglessness. And ultimately, we find meaning through creating, loving, working, and really understanding that suffering is a part of life. And so a group facilitator through this lens um, will look to find, what are the person's values and how can they create meaning making, certainly relational connections. We're looking to develop the people, develop their most authentic self, but recognizing that that is never a static experience. Again, through this lens, I would say that therapy is not necessarily time bound. And the Serenity Prayer is a good example of sort of the radical acceptance that we're talking about of the self. It's just, help me to understand what I can change and help me to understand what I can, and then to accept all of that. So we're really focused as existential leaders, or as leaders who are maybe working through other lenses, but want to use existential approaches, that we are focused the group on raising their own self-awareness. What choices do they have? What choices might they not have? And where do they truly have responsibility to make change? We're really emphasizing the client's subjective reality, and so how their worldview, understanding what that is and working within that frame. While also at the same time, there's a dialect there, also helping them at the same time to extend that subjective reality view. Uh, and how we intervene often has to do with our own value system around the meaning of life and death, and these major areas that we're talking about: freedom, what it means to be authentic. And again, this is a process-oriented approach. So the counselor's using questions and silence and making interpretations. But the group itself needs to be high enough functioning to be able to act as a group. It's a great approach because it focuses on empowerment. This is a very humanistic approach. It's under that umbrella. So it's all about just recognizing that, suffering is a part of life, and that we got to sort of figure out what it means to be a human. Ultimately, we're looking for deeper understanding. And what is the interconnectedness between deeper understanding for the individual and within the group? What are some of the universal struggles that we can explore in the group experience? Again, it's not always relevant for all folks. I think that you really do have to have a higher functioning group to do a purely existential approach. But questions about death, the meaning of life, and how much freedom somebody has to address transgressions in relationships, or to continue to suffer, maybe with stress-related symptomology, all of that can be explored and addressed through this approach and with these attitudes and techniques. And that is it for existential.